The beauty of medicine is that, yeah, we can focus in on the patient. The beauty of public health is where we actually look at that whole population, that whole community together and figure out how can we best meet the needs.
Looking at a population, trying to understand what are their health issues, health problems, and then what can we do as a community of public health professionals to prevent these health issues, safety issues that impact people's livelihoods.
The next thing that public health does is it looks at the system, all the things that might go into that population. And it could be, social behavioral things. It could be environmental risk or occupational risks.
Work is really important. Every one of us here wants to work, and we want to be healthy in order to work so that we can really support ourselves, support our families, and live good lives.
One of the unique things about Minnesota is that we are an agricultural state. We're noted for our swine production, soybeans and corn. And so that rural community, even though small, is an important part of the economy of Minnesota. And with that, there are some inherent risks. And actually, agriculture is one of the more dangerous occupations out there.
Agriculture is one of the most hazardous industries in our country and throughout the world. And we can look at the farm setting as a really interesting place where both people live and work. It's also, it's the breadbasket. How do we create food for our community, for our world? We look to farmers, and yet look at the types of hazards that are on the farm, and the fact that many farmers really live in communities where there are less resources available for their health and safety.
One of the interesting issues with an agricultural workforce is finding workers. And here in Minnesota, we have a low unemployment rate. And so we try to attract workers, and many of those might be immigrant workers.
Most of the workforce in dairy farms are immigrants, Spanish-speaking, and many of them come from Mexico and Central America. They are facing the realities every day, and the shifts are long. Things can happen in a second, and that can affect them for the rest of their lives. Anything that happens to them, it has larger consequences. It affects the family, it affects their income, it affects the farm, it affects the cows.
And these are individuals that are not going to fall into kind of some traditional, healthcare accessibility, either because of language or because of other cultural issues.
How will they know what are the safety procedures and mechanisms? Do they even understand how to safely operate a piece of equipment? Are there trainings available in their language that they can understand?
They want their workers to be safe. They want their workers to be healthy. They want the cows to be healthy and happy. So they want workers to be trained. They want an educated workforce. So they have invited us to be there, and we are there for that reason, that the trainings are free of charge. The trainings have been approved by OSHA. They have been designed thinking about where the workforce comes from, what language they speak, and what will be an easy way to engage the workers. It's very satisfying to give these trainings and to be there with the workers and to learn so much from them. These are very intelligent people. If the worker is safe, if the cow is also safe and happy, it's good for the farm. It's really a win-win situation for everyone.